All right. This information is to inform parents of the dangers that psychotropic medications present children and adolescents. According to Schroen, there is no database that exists that talks about the efficacy, safety, and ethical issues that surround prescribing psychotropic medications to children. According to McCune, adult patients actually prefer psychological treatment over pharmacology treatment. My story is the reason why this is important to me is that I work with kids ages 5 to 18. I've seen firsthand that many of these children are being prescribed medications, some of them multiple medications, up to 10 to 15 different medications. One medication treating one symptom, another medication needed to treat that symptom created by that medication, and on and on and on. So it's very important that we find out exactly why these medications are needed and what true efficacy they are having with the client, or are they just being prescribed to be being prescribed? What do we currently know about the dangers of psychotropic medications? Well, according to AIR, in adults, we've seen a life expectancy drop of anywhere from 10 to 20 years. In many cases, that's as a result of developing cardiovascular disease. Um, and that creates issues with the primary care physician where they have to prescribe other medications to treat the cardiovascular disease, and in turn, they create additional comorbidities where the two medications may clash or may not work well together. According to Albert, many of these drugs that they are giving children today don't have the proper approval standards and were basically garnered their approval through short-term efficacy testing. And according to the American Psychiatric Association, the lack of funding for psychological care and treatment options has led to a fivefold increase in the pharmaceuticals being used and prescribed to children today. So, what we're going to do is we're going to examine the impact that these drugs have on adults and why treatment with medication can be a high risk. Uh, the top three medications being prescribed in the United States right now are Zoloft, Lexapro, and Wellbutrin. All three of these medications treat either anxiety or depression, and all of them come with different side effects, including suicidal ideation, unusual dreams, heartburn, irregular heartbeat, and even anxiety. And Wellbutrin has also been shown to increase suicidal thoughts in children. So, another issue there. More testing is needed to determine, according to Albert, more testing is needed to determine the efficacy and safety of these medications. And according to AIR, the major concern is that these medications received approval based on short term efficacy and not the normal approval process. According to Psych Central, the top three ADH drugs being used today in the United States are Concerta, Vyvanse, and Adderall. Now, all three of these medications contain an additional warning um, unique to themselves because they are a Schedule II narcotic, which means that they have an additional risk of causing an SUD, a substance use disorder, or further addiction problems down the road. Um, One reason for the big push, according to AIRS, is that there has been a lack of breakthrough in the mental health um, treatment and the increased profits these medications have caused. These three ADH medications combined, according to Psych Central, for over $8.64 billion in revenue. Another issue, according to AIRS, is that primary care physicians are currently prescribing antidepressants without any necessary training in that field of study. And according to Paul and Plotter, treatment of mental health has become stagnant over the last 50 years, and that's what has led to the increase in the pharmaceutical prescriptions. But however, many of these scientists are working to remove the compounds that cause many of the adverse effects that we see, similar with the cardiovascular disease. Uh, According to AIR, this database needs to be developed on safety, efficacy, and ethical issues so the parents can make a sound judgment when it comes to prescribing these medications to their children. Uh, This lack of breakthrough allows us to use Schedule II narcotics when treating ADHD in children and adolescents. And according to Albert, these particular medications cause irreversible long-term damage on developing subjects, including children. The mental health community needs to look at the alternatives uh, to medications instead of leaning on medications first. We need to look at holistic approaches that involve both the client and the therapist. According to Ivanov, research is needed to investigate how the biological differences in human beings impact the efficacy of different medications. More research is also needed. Modern medicine has seen advancements in treatment options in both preventing and curing disease and illness. But in pharmaceuticals, finding a cure is sometimes the elusive. Um, yeah. However, danger exists when prescribing these medications to children. What we see, according to Ayers, is heart issues, suicidal ideation, anxiety, depression, and even the possibility of addiction. Short term efficacy trials were unethical and should not be allowed for prescribing these medications. Uh, According to Albert, research has shown that these medications can cause irreversible damage in the developmental stage of children and adolescents. A reduction in life expectancy can be seen in adults anywhere from 10 to 20 years. And according to the APA, an increase of five-fold prescriptions being written has occurred as a result of lack of funding since 1993 to 2002. The fact is that these psychotropic medications present a substantial long-term risk to children and adolescents because there is a lack of studies, a review of efficacy, and safety concerns. And it's because of these shortcomings that millions of children in America will be facing a long-term health crisis because of these unproven and unvetted medications.